Dr. Gabor Maté, a renowned physician and author, offers profound insights into the nature of trauma, addiction, and human behavior that challenge conventional medical wisdom and provide a compassionate framework for understanding and healing. His approach, rooted in decades of clinical experience and personal reflection, offers a transformative perspective on mental health, addiction, and personal growth. At the core of Dr. Maté's philosophy is the understanding that many physical and mental health issues are rooted in childhood trauma and stress. He emphasizes that trauma is not just about extreme events, but can result from subtle, chronic stressors during developmental years. This perspective shifts the focus from treating symptoms to addressing the underlying causes of various health conditions. Dr. Maté's approach to addiction is particularly groundbreaking. He views addiction not as a moral failing or a disease, but as an attempt to cope with pain and trauma. The question is not why the addiction, but why the pain, he states, encouraging a compassionate understanding of addictive behaviors. This viewpoint challenges societal stigmas and opens new avenues for treatment and recovery. The concept of self-acceptance is a recurring theme in Dr. Maté's teachings. He advises, accept yourself. It's not your fault, it's not a fault, just accept yourself. This message of self-compassion is particularly powerful for those struggling with mental health issues or addiction, offering a path to healing that begins with self-forgiveness and understanding. Dr. Maté emphasizes the importance of understanding the adaptive nature of many behaviors that later become problematic. He explains that stress-sensitive children often develop coping mechanisms that, while helpful in the short term, can lead to difficulties in adulthood. This insight helps individuals reframe their struggles as understandable responses to their environments rather than inherent flaws. The interconnectedness of mind and body is a central tenet of Dr. Maté's philosophy. He criticizes the modern medical system for its tendency to compartmentalize health issues, arguing that many physical ailments have psychological roots. His holistic approach encourages healthcare professionals to consider the whole person, including their life experiences and emotional well-being, when treating any condition. Dr. Maté's perspective on trauma is particularly nuanced. He differentiates between stressful experiences and traumatic ones, noting that trauma leaves a lasting imprint on the psyche and body. He describes trauma as a wound that can manifest in various ways, from hypersensitivity to emotional rigidity. Importantly, he emphasizes that while traumatic events cannot be undone, the internal wounds they cause can be healed at any time in life. The role of authenticity in healing is another key aspect of Dr. Maté's teachings. He encourages individuals to trust their own truth and to deepen their relationship with it. This advice extends beyond personal healing to professional pursuits, as he recounts how following his own truth led him to his calling as a writer and healer. Dr. Maté also addresses the pitfalls of deriving one's sense of worth solely from helping others. He warns that this can become an addiction in itself, leading to a cycle of temporary satisfaction followed by the need for more external validation. This insight encourages a more balanced approach to self-worth and service to others. The importance of internal work alongside external achievements is a crucial element of Dr. Maté's philosophy. He advises that for every effort made in the world, an equal amount of internal work should be done. This balance ensures that one's external actions are grounded in genuine self-awareness and personal growth. Dr. Maté's approach to healthcare is revolutionary in its emphasis on understanding the patient's life story. He criticizes the current medical system for often failing to inquire about crucial life experiences that may be at the root of physical or mental health issues. This perspective calls for a more comprehensive and empathetic approach to patient care. In essence, Dr. Gabor Maté's teachings offer a compassionate and holistic approach to understanding human behavior, mental health, and addiction. His insights challenge us to look beyond surface-level symptoms and to consider the deeper, often hidden causes of our struggles. By emphasizing the role of childhood experiences, trauma, and societal pressures in shaping our health and behavior, Dr. Maté provides a framework for healing that is both deeply personal and universally applicable. His message is one of hope, emphasizing that healing is possible at any stage of life, and that understanding and compassion, both for ourselves and others, are key to this process. Dr. Maté's work invites us to reconsider our approach to health, both as individuals and as a society, encouraging a more integrated, empathetic, an ultimately more effective way of addressing human suffering and promoting well-being.